Pediatric cancer is the leading cause of death by disease for children in the United States. Only 4% of federal funding is used for research on pediatric cancer annually. Now, one local organization is getting results for children to find more treatment options. Bridget is standing by now to ask a doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
Research is key to finding a cure. Joining us today, Dr. Brian Tullius. He is a pediatric oncologist with AdventHealth Pediatrics, who's also working alongside Cannonball Kids Cancer Foundation in finding better treatment and ultimately a cure for pediatric cancer. Thanks for taking some time out to stop by. In your office, you said you specialize in pediatric oncology, specifically with bone marrow transplant issues. So, how's that going in this area?
Great. We are one of only 2 hospitals in the area that do bone marrow transplant specifically with pediatric patients. So we end up pulling from the entire Central Florida area for patients that need a bone marrow transplant.
And you're doing research as well with what we call natural killer cells. So how is that research going? What's involved with that?
It's been going well. My mentor, Dean Lee, at Nationwide Children's Hospital, was the first to come up with a way to harness a specific cell within the immune system, the natural killer cells, to treat cancers, adult and pediatric. So it's really been a pleasure to be able to bring his research here and at least claim a little piece of it as my own. So that's been an awesome experience.
So what happens when you're going through that research and doing that type of treatment? Are you using the patient's own natural killer cells, or are you, getting them from a donor of some sort?
Yeah, that's very trial specific. So patients' own natural killer cells could be used, and we do have a partnership with UCF for taking a patient's own cancer cells and doing natural killer cells and doing some gene editing to them to see if we can make them into better cancer killers. But in other trials, like the one that we're doing with some funding from Cannonball Kids, we take other people's cells, we do some work in the lab with them, and then turn them into better cancer killers.
So, we've known about this type of thing. What gives you hope? What gives you encouragement in the work you're doing?
A lot of the times it's the results. There's been some fabulous adult trials that have shown that there's really great potential for natural killer cells being a game changer in leukemias that up until now we've made great progress in treating especially pediatric leukemias, but there's some leukemias that just have been elusive to beating with chemotherapy alone, and it's really the immuno-oncology era is what we call it, using your own immune system or using someone else's immune cells to combat your cancer that are unlocking the potential for better cures.
And a big part of this is the funding for the research. Tell us more about Cannonball Kids Cancer Foundation and how they've been able to raise these funds for this important work.
They were wonderful. We were getting ready to launch our trial with the natural killer cells and realized that we had a funding shortfall. And it was specifically for the funds that we needed to infuse the cells for each patient. And we came to them and said, what an awesome opportunity. We're asking you to fund the piece of actually bringing potentially curative therapies into children's lives. And they jumped at the opportunity. And within a single day, I went from not knowing if I could open a trial to having everything we needed to get the doors open.
That has to be so rewarding.
It was amazing.
How can we support, where can we go for more information?
There's multiple groups all throughout Orlando. Cannonball Kids is an excellent one. They have their website, which you can access and contribute to their cause. And I highly, highly encourage you to check them out.
All right. Well, thank you so much for taking some time out, Dr. Tullius. And
my pleasure.
Best wishes on all the research. I'll send it back over to you, ladies.